And there we go. Okay, can you hear me?
Yes.
Okay, very good. Well, thank you for that introduction. I wish I could be there in person, but unfortunately that was not possible this year. I'm sorry to miss the meeting, and I hope to see many of you next year. Need to begin with a disclosure about another role that I play that is different from my role in the University of Michigan. And I really want to start my remarks tonight by talking about a big idea. And it has become apparent to me since I've been working with the learning health system that the most powerful aspect of the learning health system is that it is a very, very attractive idea that basically draws people and stimulates their imagination. And what I've learned is that transformation of anything, and in this case we're talking about transformation of health and healthcare, has to begin with a big idea. And it turns out that I was in a bookstore looking for a book for my granddaughter, who was about 4 years old at the time, and I found this book called What Do You Do With an Idea? And it's a wonderful book, actually written by a Japanese-American author, Kobi Yamada. And the more I read this book, the more I realized that it really told the story of the learning health system. And I won't show you this whole book, although it might be more interesting than my talk. But I will show you a page that is from the end of the book, or almost the end of the book. This is a story about a child who discovers an idea and watches it grow from something very small into something larger and larger because it was a big, important idea. And toward the end of the book, he says, I don't know how to describe it, but it went from being here to being everywhere. It wasn't just part of me anymore. It was now part of everything. And I think this is what's happening with the learning health system, and this is the story that I really want to tell you tonight, or in your case, this morning. My main points for today will be two in number. First, I'm going to review very quickly the key aspects of the learning health system, or learning health systems, because I don't think it's correct to talk about the learning health system as if there were just one of them. I think we have to recognize that there is and will be many learning health systems, and we should refer to this term in the plural. I will get through this pretty quickly because I think many of you there are familiar with this concept by now. And then I want to go to my main point about this big idea becoming everywhere. And I'm going to tell you about many channels of progress, not just in the United States, but in many places around the world that are moving things very quickly now toward the achievement of learning health systems. And I hope you find this review to be interesting and even enlightening. So basically, the definition I like about the learning health system is a very short one that you see at the top of this slide, that health systems of any size at any level of scale can become learning health systems when they acquire the ability continuously and routinely to study and improve themselves. I would emphasize that as much as I talk about learning health systems, this was not my idea. It was the idea of the U.S. Institute of Medicine. It first developed around 2007, so the big idea is about 10 years old. And the Institute of Medicine has written many articles about the learning health system and many books. There have also been many papers, such as the one illustrated here, talking about the learning health system. People who think about the learning health system have developed three, what I call anthems, three sayings that really capture what the learning health system is about. One is that the learning health system provides an opportunity to learn from the experience of every patient. Another goes to the fact that most of the problems with healthcare delivery, certainly in my country, and I think in many places around the world, are not problems with the people, are not problems with the deliverers of care, but rather are problems with the system. And if you're going to fix a system, you can't fix a system by fixing the people, especially if the people don't need fixing. A system problem needs a system solution. And finally, the third key idea about a learning health system is its potential to shorten the time interval between the discovery of new biomedical knowledge and its widespread use in practice by whole orders of magnitude of time, from 17 years, which is what is believed to be that interval now, to months, to weeks, to days, and maybe even to hours under certain circumstances. I like to think that a learning health system can be described with these 5 properties, that every participating patient's characteristics and experience are available to learn from. This is the learn from every patient idea. That best practice knowledge is immediately available to support decisions. This reflects in part the anthem about reducing the latency between discovery and application of knowledge. That learning health systems do this all the time is the third characteristic. They don't do it episodically. They are always learning and improving. The fourth point is that they have an infrastructure that enables them to do this routinely and to do this with economy of scale, so the effort is sustainable. And finally, that all of this is part of the culture of the settings where learning health systems exist. And if you ask the people why they're doing this, they almost can't answer the question, because people have a hard time answering a question about culture. They just say, if this is our culture, this is what we do, and this is who we are. Learning health systems can exist at any level of scale, from single organizations to networks of organizations to states, territories, and regions, and that's Michigan, where I live, in the middle there. Nations like Taiwan, and maybe even at the level of the whole planet. And I will return later in my talk to this issue of scale to describe how learning health systems are developing at all of these levels. Learning health systems operate, how they learn and improve, by implementing these virtuous cycles of study and change that have 3 parts: a blue part, which takes data and which assembles data and analyzes that data and uses the results of those analyses to generate new knowledge. The blue part then transitions to the red part, the K2P, where that new knowledge, those results that are interpreted, are applied through messaging and other methods to influence practice. Action is taken in response to those messages. And then in the third component, the green component of the virtuous cycle, data are collected regarding the results of the actions that are taken. This generates new data that then feed the next iteration of the cycle, and it is over successive iterations of these virtuous cycles that improvement occurs with regard to whatever health problem is the focus of this effort. There's been a great deal of discussion about precision medicine and precision health as an emphasis of where health improvement activities should go. And I'd like to tempt you with the idea that we can think of precision medicine as a form of learning cycle, and precision medicine, therefore, as a kind of implementation of learning health systems. That if you view the purpose of a learning cycle to be in some health domain tailoring the intervention to the individual patient, then by assembling data which can be genotypic, phenotypic, environmental, and other data, along with the health status of the patient, you can analyze that data, relating these variables to each other, interpreting the results, which would be the relationships that you find, and then applying those results to the care of an individual patient. In other words, concluding it in the messages that would be sent in the knowledge to performance part of the learning cycle. The messages would be of the form, for this patient, the best therapy is, and that would be for the patient based on the patient's genotype and other characteristics. Then action would be taken to administer the recommended or other therapy. The results would be recorded, and then further learning would occur from study of those results. I think it is interesting to consider how precision medicine might be considered as a learning cycle, and therefore as a concept very closely related to the concept of the learning health system. I want to emphasize the importance of the completeness and the execution of complete learning cycles, and I like to advance this very simple equation as a proposition that better health results from putting D to K, data to knowledge, together with knowledge to practice, K to P, together with practice back to data, P to D, and that you need all three in order to realize the full potential of these learning cycles and learning systems. In other words, better health requires this and not this. I'm of the belief that if what we do with our data analyses and the results that are generated from them is to put them in journals and not pay explicit attention to the need to execute the red side and the blue side of the learning cycle, what we will end up with is this 17-year latency, or a perpetuation of this 17-year latency between the generation of new results and their application in practice. And of course, reducing that time latency is one of the goals of learning health systems. So this completes my quick review of what learning health systems are about. I hope I didn't go too quickly for those of you who may be encountering this concept for the first time, but I also know that many of you have encountered this concept before, so I wanted to go quickly through this in order to get rather quickly to my second point and my main point for today, which is the global progress that is being made toward achieving learning health systems. So what I'm going to talk about is what happens to a big idea, or what is happening to a big idea, and how perhaps this idea that was a part maybe 10 years ago of a very small number of people is now becoming a part of everything. And I really do believe that this is what's happening, and that I can convince you this morning that this is the case. And I think the learning health system is becoming part of everything in many ways. We're seeing it in literature and policies. We're seeing it in initiatives at these different levels of scale, single organizations, networks, regions, nations, and multi-nations. And we're seeing it in the development of science and components of this infrastructure, which, even though I didn't discuss this in detail, I see as an absolutely essential component of learning health systems if they are going to be scalable and sustainable. So literature, there's lots of it now. So if you want to corroborate many of the things I'm saying. You can go to this literature, and one place you can go is to a series of books and monographs issued by the U.S. Institute of Medicine, now called the National Academy of Medicine, one of which, called The Digital Infrastructure for the Learning Health System, is illustrated here. If you go into Google Scholar and search on learning health systems, you will find over 1,900 results now. Not all of these are exactly about the learning health system as I am describing it today, but many of them are, and there is indeed a substantial emerging literature. And to be a little bit referencing of myself and our work at the University of Michigan, there is now a new journal, Learning Health Systems, which is an open access journal which has published, which has now published 3 issues and will, no, 4 issues, completing the first volume of this quarterly journal. And I highly recommend this journal to you. And you see a picture of the cover there, even though it's an open access journal and nothing is really issued in print. So the idea of a cover is just an image on a website, but this is what the cover looks like, and I highly recommend the journal to you. So we can talk about single organization initiatives now, and some that are happening, and there are many examples around the world of organizations that are establishing their own ongoing learning health cycles in pursuit of becoming learning health systems at their level of scale. And some of these institutions, and I'm proud at Alan's suggestion, based on his work there, to include Taipei Medical University among those that are taking this direction. There are, of course, many more across the U.S. And around the world. It's almost impossible to keep count of them, but many of the most eminent and well-known institutions in the world are moving in this direction. Whoops. So now we can talk about networks. I'm not sure why I'm having trouble with my slides here, but bear with me a little bit. Networks are a very interesting aspect of learning health system development. And what we see in networks are different organizations coming together, usually around specific kinds of diseases, like cancer, for example, and becoming learning health systems focused on those diseases across institutions. And they do come together for many reasons. Not surprisingly, pediatrics became very active in this very early because in many cases they need to pool the data from multiple organizations in order to have sufficient data to draw reliable conclusions as they execute the D-to-K aspect of their learning cycles. But as you can see here, I'm using the examples mostly from the U.S. here. There are very large and very numerous examples of networks that have demonstrated in many studies. For example, the Michigan Surgical Quality Collaborative, that the quality and safety of care and morbidity and mortality reduction can occur through cooperative work among healthcare institutions, in this case throughout the state of Michigan, focused on surgery. What's of course most interesting about these networks, and this is a problem not unique to the U.S., but certainly is a problem in any country that does not have a single payer system, that what we're seeing in these networks is collaboration and cooperation across institutions that actually compete with each other for patients. They have decided not to compete around quality and safety because it's just too important, and they have chosen to collaborate for that reason. A very important network called CancerLink is forming in the United States through something called PCORNet. The U.S. is setting up a national network for patient-centered research that is becoming very prominent and very well used. And these are just a few examples. I will mention one called Improve Care Now. This is a network of institutions that are focused on child health. And Improve Care Now has focused initially in its first project on inflammatory bowel disease in children, and has actually, over not too long a period of time, increased the remission rate for children with inflammatory bowel disease in the U.S. from 50% to almost 80% through learning cycles and the methods of the learning health system. There are also networks that are improving, that are developing evidence and evidence-based guidelines, and these are shown, some of these are shown on this slide, including the Clinical Pharmacogenomics Implementation Consortium, which is producing very, very valuable and validated guidelines that relate genomic information to therapeutics. The UK has two nationally known or internationally known and highly regarded organizations of this type, and there are others. Next are state and territory and regional initiatives, as we're moving up the levels of scale here. And I will turn first to Northern England, which, as you may know, has basically become a separate component of the British National Health Service from the component serving Southern England. This is called de-evolution in England of the National Health Service there. And Northern England has started something called a Connected Health Cities project. And through this Connected Health Cities project, they are doing many, many things that are closely aligned with the concept of the learning health system, including the development of a learning health system to treat and control alcohol abuse as one of their featured projects. Further to the north in Scotland, another regional emphasis, and Scotland is not yet an independent nation, may never become one, but may also become one. We don't know what the future holds for Scotland, but Scotland is in the process of creating a learning health system focused on asthma. Asthma is a major health problem in Scotland, and they are moving in that direction at the level of the entirety of Scotland. Now, national initiatives. We are very excited to be working with the National Health Research Institutes in Taiwan, and hoping to see the vision for a national LHS initiative develop in Taiwan. The Swiss are actually the first nation to formally announce a national initiative to make the entire country of Switzerland into a learning health system. This is the first of what may be many such initiatives, and I'm actually very honored to be a consultant to this effort. I'm advising the Swiss on the development of their learning health system, and they are doing this through efforts distributed across 8 locations in Switzerland. And this is going to be obviously a many year effort, but it is exciting that Switzerland has announced not only their intention, but has set in motion effort with significant government funding to move toward a national learning health system. In the U.S., things are not quite that focused or simple, but we are seeing increased government-level recognition of the learning health system in the United States. As was said in that very kind introduction, I was at the Office of the National Coordinator for Health Information Technology from 2007 to 2011, and during particularly the last 2 years I was there, I worked very hard to promote the concept of the learning health system into a national policy goal. This did not happen while I was still there, but I was delighted that a few years after I left, in 2014, this organization, which does speak on a policy level for the entire nation with regard to health information technology, did establish in their long-range plan the realization of a national learning health system by 2024, in other words, as a 10-year goal. The Agency for Healthcare Research and Quality in the United States has made the learning health system its primary thematic emphasis, and this is extremely exciting for us in the U.S. And they are doing more than just issuing policy statements. They are, for example, about to fund a number of training programs to fund what they're calling learning health system scientists. These are people who will be trained to be researchers who will develop learning health system concepts, and also implementers who will find themselves in positions working in support of the development of learning health systems. So there are important things at the national level going on in the U.S. as well. And then there are multi-nation initiatives going on that are very important to point out. One of the most important of these is taking place in Europe. This is the new Institute for Innovation Through Health Data. This organization spans the entire European community. They had their first meeting in Madrid, Spain last month, and it was a very successful meeting. And I would encourage you all, if you're interested in how the learning health system concept can spread across nations, to go to the website of this Pan-European Institute. And then, of course, earlier this year, we were delighted to see the occurrence of the first Asia-Pacific Conference on Learning Health Systems, in which multiple Asian nations were represented. This development is not quite as formal as the European Institute, but it certainly is a step in the direction of achieving learning health systems through cooperation across nations in Asia. So finally, my last set of comments about how the learning health system is, as in the children's book, becoming part of everything. I'll say a few words about science and infrastructure. A project called Transform that was funded in the amount of about 15 million euros by the European community actually has, the project is now over and parts of it are continuing, but during the duration of the project, about 10 institutions across Europe banded together to develop a European digital infrastructure for the learning health system and work to build learning health system components, working in close cooperation with the European Institute that I described earlier, is now ongoing. And closer to my home, I'll make a few remarks about some infrastructure we are developing as a precursor or as an introduction to the remarks that Alan Flynn, my colleague right there in the room with you, is going to make later. We've become very interested in the idea and the importance of knowledge sitting at the top, at the very top of a learning cycle, and in our way of thinking, representing the keystone that holds learning cycles together. In other words, if learning cycles are going to successfully undergo the transition from the data to knowledge stage to the knowledge to practice stage, it's very, very important to represent in some persistent and we will argue computable way the knowledge that comes out of the D to K side of the learning cycle, so it is available to be put to use in the red side, in the knowledge to performance or K to P side of the learning cycle. And therefore, it's this knowledge sitting at the top of the learning cycle that enables discovery systems which can be very successful in generating results that go into journals, into learning systems that go beyond that and explicitly take that knowledge and use it to drive changes in practice and ultimately improvements in health. What we are developing and what Dr. Flynn will be talking about later on today is specific infrastructure components that we call the knowledge grid that support this K to P side of the learning system, of the learning health system and the learning cycle by enabling these lessons learned to be transformed into informed decisions and actions. He will say more about that later, but coming back to the main theme of my remarks this morning, I'm using the knowledge grid as an example, along with, as I referred to earlier, the work going on and on the basis of the Transform project as examples that there is important science and important infrastructure development going on as part of the advancement of learning health systems globally. So this brings my remarks to a conclusion. I want to leave you with two big ideas about the big idea, going to my two main points for today. I want to leave you, as a result of that quick review of learning health systems that I did, with a repetition of this simple relationship that better health results from D to K, K to P, and P to D, thus reiterating the importance of executing complete learning health learning cycles. And secondly, I hope I have convinced you by referring to very specific examples of global progress at multiple levels of scale that indeed learning health systems are beginning to become part of everything. So thank you very much. I appreciated the opportunity to share these ideas with you, and if there is time for questions, I would be happy to entertain them. Thank you very much.